Cocaine is categorized as a tropine alkaloid, which is extracted from cocoa leaves. It is also named as a TRI, which means a triple reuptake inhibitor. It blocks reuptake of serotonin, noradrenaline, and dopamine via the inhibition of monoamine oxidase and blockade of the dopamine transporter. This mechanism mainly escalates the level of dopamine in the limbic system reward pathway, which results in euphoria. This euphoric effect is synergized due to the lipophilic and hydrophilic structure of cocaine that allows it to penetrate the blood-brain barrier rapidly that causes addiction.
However, the effects of dopamine are dwindling due to the desensitization of dopamine receptors. As a result, a higher dose of cocaine is needed to achieve the same euphoric effect known as tolerance. The mechanisms of addiction and tolerance ultimately lead to a toxic dose of cocaine. Hence, this could be life-threatening as it mainly affects the central nervous system and cardiovascular system. The cardiotoxic effect of cocaine is mainly caused by the blockade of voltage-gated sodium channels, which could lead to a fatal cardiac arrhythmia.
There are three reported phases of acute cocaine toxicity. Phase 1 or early stimulation phase. There are central nervous system symptoms such as mydriasis, headache, vertigo, preconvulsive movements, and pseudo-hallucinations. Apart from this, elevated body temperature and agitation are present as a toxic effect of cocaine. Phase 2 or advanced stimulation phase. Malignant encephalopathy, generalized seizures, decreased responsiveness to all stimuli are examples of central nervous system effects. The cardiovascular effects are hypertension, tachycardia, and ventricular dysrhythmias, which ultimately lead to cardiac arrest and shortness of breath in the respiratory system.
Phase 3, also known as depression and premorbid state, usually has respiratory depression. This results in the central nervous system effects such as coma, areflexia, flaccid paralysis, and loss of vital support functions. It is also ventricular fibrillation that may lead to cardiac arrest. Another prominent sign in phase 3 is an increasing level of creatine in the urine due to the muscle breakdown, which is known as rhabdomyolysis.
In the long run, it also causes changes in personality, build-up of plaques in the blood vessels, and risk of severe bowel gangrene. Cocaine toxicity is a life-threatening condition and must be treated properly as a medical emergency. A pharmacodynamic approach. Emergency treatment. It is important to maintain the vital signs of the patients by establishing the patient's airway, breathing, circulation, which is known as ABCs, and physiological temperature. For combative patients, due to the hallucinations and convulsions, benzodiazepines can be applied to reduce the initial central nervous system and cardiovascular system effects of the drug. The inhibitory actions of benzodiazepine through GABA neurotransmitter alleviate the hyperexcitability of the central nervous system. This helps to manage toxic symptoms like seizures and ventricular fibrillation. Nitroprusside is a vasodilator, which is used in the treatment of malignant hypertension because it can result in hypertensive encephalopathy. In the case of cardiovascular collapse, vasopressin is used to achieve physiological blood pressure by acting on V1A, V1B, and V2 receptors in the blood vessels, which result in vascular constriction. Long-term treatment. Presently, there is no pharmacotherapeutic antidote to treat cocaine toxicity for the chronic users. However, vigabatrin, modafinil, tiagabine, disulfiram, and topiramate have been reported to manage the symptoms of toxicity. Additionally, cognitive behavioral therapy is used as a behavioral intervention to manage cocaine addiction. Overall, the treatment of cocaine toxicity aims to maintain the vital signs of the patient. Long-term management is to minimize the relapse of cocaine addiction. Therefore, the optimal treatment is by managing short-term and long-term conditions simultaneously, as well as avoiding the environmental conditionings that might aggravate the addictive behavior.